Hi, my name is Robert Lampy, and we're going to show you a couple of things about a new IV pole we have. This is a prior IV pole. It's pretty standard. Get it pretty much anywhere if you want to get some poles up in your hospital. This one here is actually straight out of the box, nothing done to it yet, and it doesn't work for us here. So we're just going to make a couple of quick changes, and then we of course have to get a PM to make sure it's safe to use on patients and get it into the system. So to start, we're going to actually take this thing apart, and we have to add a surge protector and a spill cover to the top of it at the bottom with oxygen tank holder. And then there's also a collar that we're putting on here to separate how high up our new pumps can go, because they're kind of heavy, and when nurses put them up too high, they become a tip hazard, and this whole thing will fall over. So to start off with, we're going to actually just take off the top here. So I'm going to get my Allen wrench. I'm going to loosen up this screw. Just going to take the whole thing off. And next, we got these two pieces come apart. So I'm just going to take the Allen wrench out of that too. This whole thing should just pop up. And I'll show you why that was taken apart in two pieces when we get to it. What we're going to do now is we actually have our oxygen tank holder, and what happens is the surge protector snaps onto the back of it, and the whole thing gets mounted onto the pole. But we have to do it in stages. So first off, we're going to put these on. Take our surge protector here. That attached like that. And we got that all set up. So now we'll need to safety check that when we get to that step. First, I want to put the rest of the pole back together. So first, I think the first half we took, put it back on, and this has two screws in it. I'll lock it into place.
Yeah, I'm getting ready to start now. No.
Now to put the collar on, we have a calibrated piece of copper that we've cut to the right size so that we know what the maximum height is for each of these. So we just take our collar, start it, and we can tap it to the right height. And then just for an additional piece of security, we also put a red piece of shrink wrap on it, just so that they know that that's the upper limit and nothing should be placed up there. So we're going to put this back on now, just sort of complete our pole. just shrink wrap this back on there. What we have to do as far as looks is concerned is we have a special piece of tape we're putting up here. That way if we're walking by a patient room or we happen to see this in a pile of other IV poles, we can tell if this one's been done or not. Our current PM for next year is going to be purple, so we're going to be putting purple tape on it just so we know what quarter it's in. And that's your completed IV pole. We just got to safety check it to make sure that this surge protector isn't been broken or the ground plug been shorted in any way. So we'll plug this in. And we get 18 microamps, which passes for us. 300 is the maximum amount of leakage you can have out of it. And then we're going to switch to ground. Just find a good ground test here. And 0.077 ohms, so 77 milliohms, which is also passing. 500 is the max we can do there. So that's our completed IV pole. We're just going to put some stickers on it, put it in the system, and that'll be it. Thanks.